Hello everyone, I'm Dr. Jaspinder Kaur, Consultant Radiation Oncologist at Cancer Centers of America, Ludhiana. So commonly patients ask us what is the difference between a screening mammogram or a diagnostic mammogram. So basically the procedure for both the mammograms is the same. Screening mammogram is when we do the test when actually we don't have a diagnosis for the patient, which is basically done for the screening. So what is basically screening? A screening test is which is done when the patient has actually not developed any symptoms or any palpable lesion, and we are just screening the patient or testing the patient for a possibility of disease. Diagnostic testing is when there is some clear-cut indication or symptoms a patient has when we do the tests according to the symptoms of the patient. So what can a patient expect during a mammogram procedure? So mammography procedure is similar to getting any other x-rays done with a little bit of difference in the procedure. So basically we take, usually it depends on what kind of mammography is being done, because we have the normal mammogram in which a photographic film is used. Then we have the 2D or the digital mammograms in which a detector is used. And now we have the 3D mammogram or the tomosynthesis, in which again an X-ray tube is moved over the breast tissue for digital imaging.